Hey guys, welcome to this first training. We call it the Medicare 101. I've got Neil McMinn on the call here today, and he's going to be explaining the basics of Medicare, what it is and how it works to give us a better understanding of how we can service our clients. Neil, are you there?
Yep. How you doing, Zach?
I'm doing great, man. So, how long have you been selling Medicare?
So I got my start in the industry with a practice company around 2003, so going on 20 years.
That's awesome, man. Well, I appreciate you coming on, and I think you have a PowerPoint presentation you're going to go through. And as you go through it, I'll just let you go. If I have any questions or something's not quite clear, I'll ask them. But yeah, I'll turn it over to you, man.
Awesome. So go ahead and share this, and we will go ahead and start from the beginning. So Zach, what we're going to do is just kind of a basic run through of what is Medicare. We'll jump into who's is exactly eligible for Medicare. That way, whenever we're operating in our normal business capacity, we'll be able to properly identify what clients are targets for us to be able to serve and help take care of their Medicare needs. We'll talk about coverage options, where somebody can enroll, and then we'll go over next steps and then answer any questions as well that anyone might have. So first of all, who is eligible for Medicare? First of all, you have to be a U.S. citizen or a legal resident for at least 5 consecutive years, and that's a big important distinction, and one of the following: you have to be 65 or older. If you're under 65, you have to have a qualifying disability. And then also any person diagnosed with end-stage renal disease or Lou Gehrig's disease, otherwise known as ALS. So we put together kind of a just brief one-pager snapshot to help everybody in terms of reference. Instead of going through multiple pages of PowerPoint, you can, save this to your phone, to your device, and then reference this really quickly. So this will be just for informational purposes and a quick reference. But for the rest of the presentation, we'll dive into greater detail. All right, so the different options that people have are Part A, which is hospital. Part B is going to be medical. Part C is going to be a combination of A, B, and D for prescriptions. Part D, Medicare Part D, is for prescriptions. And then you have Medicare supplements, and we'll go into those as well. All right, so let's talk about Original Medicare. Original Medicare is Part A and Part B. Part A is going to be your hospital insurance. So when you think Part A, just think hospital and most everything associated with hospitals, such as inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and then some blood transfusions. Not all blood is included. Also, the costs for Medicare, it's premium free. So unlike Part B, you're not having a premium deducted each month from your Social Security check, and you don't have any out-of-pocket expense when it comes to premium. As long as you've worked 40 quarters in the United States, there is a $1,556 deductible. Now that's for 2022. That'll typically change every year. So each year, typically with the cost of inflation or cost of living, that deductible is going to go up. So when 2023 plans become available, usually around June or July, we'll make sure to update this with the new numbers for 2023. Coverage, stays of more than 60 days in the hospital all have daily copays. Up until 60 days, there's no copay. You can utilize any hospital that accepts Medicare, and because Medicare is pretty much universal, pretty much every hospital accepts them. It's very rare to find a hospital that doesn't. Hospital coverage outside of the U.S. usually is not covered. So that's an important thing to know. All right, Original Medicare, again, with Part B, this is going to be your doctor's visits and outpatient visits. So primary care specialists, that sort of thing. So physician services, outpatient hospital services, ambulance, outpatient mental health, lab services, durable medical equipment, things like wheelchairs, oxygen tanks, even hospital beds for in-home use. Outpatient physical, occupational, and also speech language therapy. And then some preventative care is also covered under Part B, things like vaccinations and things like that. Cancer screenings, different things like that. So in addition to that, under Part B, as far as your costs, you're going to pay 20% of the Medicare approved costs. So Medicare helps control pricing so that prices don't get too out of whack. And your cost share of whatever the approved cost is going to be 20%. Obviously, Medicare is going to cover the rest of that up to a certain amount. And then annual deductibles are going to be in 2022, $233. Now, your monthly premium is actually adjusted based on your income, and it might actually be higher if you sign up after your initial enrollment period. So either when you're initially eligible, if you wait, there could be a potential penalty, and we'll cover that as well. So coverage, again, is going to be physicians who accept Medicare, which most physicians do, and then also some preventative health care is provided. Okay. So what's not covered? This is an important thing to know because your clients will automatically have that question. Part A and Part B deductibles are not covered. Any co-insurances and any premiums are not covered by Medicare. That's going to be out of your client's pocket. Any Part B excess charges. So these are going to be charges above and beyond what Medicare has approved. And then any outpatient prescription drugs, also additional. Now, again, that's important to note there, outpatient prescription drugs. Additional benefits such as hearing, vision, and then most dental is not going to be covered by Medicare as well. Long-term care and also custodial care is not covered by Medicare. Part D is going to be your prescription drug plan. That helps with the cost of prescription drugs. It's only offered through private insurance companies, so you can't get Part D coverage through original Medicare. That has to come through the different companies that, and carriers that we represent. You have to continue to pay your Part B premiums as well. And then for medications you receive from a retail or mail order pharmacy, either or. All right, the cost, actually coverage varies from plan to plan, and all the plans are different depending upon your geography and the county that you live in. And plan premiums change and costs change every year. Catastrophic coverage protects you from the high costs of drugs, right? So as opposed to going broke, spending inordinate amounts of money on your prescriptions, there is a catastrophic coverage component of the plan. Benefits, like I said, do change from year to year. Now, as far as enrollment, coverage is not automatic. So unlike Part A, you do have to elect to enroll in Part D. And then same thing like Part B, if you enroll late after your initial eligibility period, penalties might be applied. As far as the coverage, each plan has a formulary or a list of drugs that are covered. Each list can change throughout the year and usually changes from year to year. All right. Now, within Part D, we have 5 different tiers, and that's how all of the prescriptions are, categorized. A formulary is the list of drugs that are covered by your Part D plan. All plans have this tiered formulary, so they're all in one of those 5 tiers as far as the different drugs. And usually the lower the tier, right? So tier 1, the lower the out-of-pocket cost. There's 4 different stages that we look at when it comes to Part D. So here's where it kind of gets a little complex. First of all, you have the annual deductible, right? Not all plans have annual deductible. And that's typically either because they have a higher premium or they're provided to low cost or low income individuals. You have your initial coverage, which is going to cover up to $4,430. And then from there, you enter what's called the coverage gap, or what we call the donut hole. So picture a donut, and you've got one side of the donut on the initial coverage. You've got this hole in the middle, and on the other side, you have your catastrophic coverage. In the donut hole, you've got up to $7,050 that could potentially be a gap in coverage for you and a potential out-of-pocket expense for the client. And then after that, you have your catastrophic coverage, and that will cover throughout the end of the plan year. Coverage cycles start over again. Yep, go ahead, Zach.
So I guess this is the part, maybe I need further explanation. So the initial coverage, it covers up to $4,430. So like if the person, can you give me an example? So like of what this means?
Yeah, so let's say I'm on 4 or 5 different drugs. I'm going to have my copays, right, for each drug, or I might have no copay. Right, the costs of those drugs accumulate up to $4,430, and then I enter the donut hole, right? And then at that point, I want to try and get through the donut hole as quickly as possible. because then I'm on the other side where the rest is going to be covered completely.
Okay.
Typically.
So the donut hole is that like $2,620.
Yeah, so it's actually going to be a total of up to $7,050 in potential out-of-pocket costs.
Got it. Okay. So after the 4430.
Correct.
Got it. Roger that. Okay.
Yep. So this is your coverage end over here, and this is your potential coverage liability of what could be out of your own pocket. And then you have the catastrophic coverage through the end of the plan year. Like I said, that's going to be there to make sure that you don't have to pay anything more out of pocket. And then again, like I said, the cycle starts over January 1st of each year. Okay. But good questions. Right. So here we kind of go into the cost sharing. So annual deductible up to $480. Not all plans have a deductible, like I mentioned. Remember, the initial coverage limit is $4,430. So in your donut hole, you're going to pay 25% of the cost of the covered drugs up to that limit, right? And then catastrophic coverage is going to jump in at $7,050 and above, right? So as soon as you hit this, think of, you may relate it to your personal health insurance plan. When you hit that out-of-pocket maximum, that's when your health insurance jumps in and pays the rest. Okay. So then at that point, your drug copays are usually reduced to $3.95 or 5% of the drug, whichever is greater. And then your brands, non-generic, are going to be $9.58 or 5%, whichever is greater. So it's important, I'll make a note there. It's important to make sure that when you're, discussing a Part D plan, whether it is a standalone, what we call PDP, prescription drug plan, or drug plan incorporated with a Medicare Advantage plan, it's important to know all of the medications, whether generic or brand name, that your client is on, and then make sure to double check and reference the formulary relative to that plan to make sure that those drugs are covered, and then also make sure they're getting the best deal when it comes to not only the potential plan premium or deductible, but also what their out-of-pocket cost is relative to those drugs. It's also, you can really anticipate, there's a lot of different calculators out there. You can plug the drugs in and then anticipate, usually based on their dosage or on their frequency of the meds, at what point during the year they either will hit the donut hole and then come out of it, or if they even will hit it. Right. So that's part of the planning process that we provide, as Medicare advisors. So there's also what are called Medicare Advantage plans. Now, they do still incorporate, a common misconception is, well, if I'm on Medicare Advantage because it is provided by a private insurance company like Aetna, Humana, United Healthcare, that I don't have original Medicare anymore, right? And that is not true, right? So you still have original Medicare Part A and B. Part D is then included, right? And all of those together, plus additional coverage provided by the private insurance carrier, are what result in Part C, otherwise known as a Medicare Advantage plan. So like I said, it combines A and B, and then may or may not, depending on the plan you choose, include prescription drug coverage. They are offered, as I mentioned, by private insurance companies and include additional benefits above and beyond original Medicare, and that does vary by plan. Right, so the eligibility for Part C, you do have to be enrolled in Medicare Part A and B. You do have to live in the plan's service area. It is county-based, right? So the plan that I might have in my county, Zach, might not even be available in your county. And I might be telling you, oh, how great my plan is, and you might want my plan, or vice versa, but that might not be available because we live in different counties. In addition to that, you have to be able to make an informed decision, all right? And that's, again, why, we as advisors are so important. Now, as far as costs, when it comes to your Medicare Advantage, plan premiums and benefits change year to year, just like those Part D prescription plans. You do have to continue to pay your Part B premium. I will make a note that there are some Medicare Advantage plans that do offer to reimburse or return the Part B premium, but again, that varies year to year and plan to plan. So many plans do actually include the prescription drug coverage, and it can be limited to a service area unless it's an emergency. right? So that's another thing to consider. And again, if you're referencing your private healthcare plan that you may have an HMO or a PPO or a POS, point of service plan. Same kind of concept applies with your Medicare Advantage, where you may be limited to only doctors that are either in that network or that service area. Obviously, in the case of an emergency, that limitation is usually lifted. You may be required to use a network of doctors and hospitals and not have coverage outside of that, or your coverage outside of that could be much more expensive. And then it may include additional benefits above and beyond original Medicare. Things like dental, vision, hearing, gym memberships are even included in some of these, and then different things like that. So the different types of Part C plans, Zach, the first thing you have what are called coordinated care plans. And you're probably familiar with this. These different terms, again, in reference to your private health plan. You have HMOs, right, which are health maintenance organizations. And then you have health maintenance organizations, POS plans, or point of service plans. Then you also have your preferred provider organizations, which are going to be your PPOs. And then you have SNPs, which are special needs plans as well. The other plans that are available are PFFSs, or private fee for service. You have MSAs, Medicare savings accounts, and then Medicare cost plans as well. So that's going to be your Medicare Advantage, right? Again, which is Part A, B, and C combined, D combined to form Part C. Zach, you had a question?
Yes, I did. So these Medicare Advantage, is there more availability? Like, where is there more availability? So I think I remember hearing like there's more Medicare Advantage availability in more urban areas and maybe not so many plans available in more rural areas. Is that what you found?
Yeah. So, and you'll see, where that kind of comes into play when we talk about the Medicare supplements, but that's a great question. And if you think about it, when you have a more urban area, you have a higher population density. When you have a higher population density, you have more hospitals, more doctors, right? More Medicare or medical service providers. As opposed to a rural area, you might have one hospital, you might have a couple specialists, right? But otherwise, you might have to travel to a more urban area, to have access to different care. So that's absolutely true.
Got it. And then I guess the other thing with these Medicare Advantages, do you just choose like one primary care physician and then, or one network, and then have to get a referral to go to other doctors?
Yep, another good question. Absolutely. So typically you're going to choose a primary care physician. If you don't already have one, the plan will select one for you based on your geography, and then you can change that if necessary. And then, yes, in most cases, again, depending on the type of plan you have, you're either limited to a network, or you do have, in the case of a PPO, you have you do have coverage outside of the network, but you are going to pay a lot less in terms of out-of-pocket expenses if you maintain or your services within the PPO.
Got it. Okay. Thank you.
Yeah, great questions. So then we jump into Medicare supplement insurance. Okay. So think about this with your Medicare supplements, instead of combining everything together, right? So A, B, and then Part D for drugs. What I'm going to do is I'm going to stay just on Part A and B. I'm going to continue to pay my Part B premium. And then I may or may not choose to purchase a standalone prescription drug plan. But now what I have is I'm exposed to the out-of-pocket expenses that are not covered by Medicare. If you recall on the previous slide, we said here are all the things that are not covered, right? Your deductibles for Part A and B, your co-insurances, and then your excess charges, and then potentially, foreign travel emergency. All of those things not covered by Medicare is where your Medicare supplement steps in. Now, it can get a little confusing, but in general, we have plans A through N, and the difference between all of them is going to be what they do or don't cover, right? So I'm going to sit down with my client, and based on what they need, I can look at different plans and say, well, since you don't really travel outside of the country much, you probably don't need foreign travel emergency. And because you're pretty young and healthy, it may make sense to only do a plan that has just a couple co-pays, but your premium is super low. or if somebody's very, very unhealthy and they go to the doctor a lot and they might be exposed to a lot of out-of-pocket costs, I might look at a plan G that's going to give them more comprehensive coverage, right? So again, it helps coverage. It's otherwise called a Medigap policy. It covers the gaps in original Medicare. It is like your Advantage plans sold by private insurance companies. You have all the different alphabet soup of plans here. You also have what's called a high deductible plan F and high deductible plan G. It is important to note that anybody new on Medicare as of, I believe, January or before January of 2020 is no longer eligible for plan F. So basically anybody that turned 65 after January of 2020 is no longer eligible for plan F. Anybody that was 65 prior to that can still get a plan F or a high deductible plan F. But basically the gist of a high deductible plan is you're going to say, you know what, I really want this comprehensive coverage, right? Because plan F and plan G cover the most. However, I'm still healthy now, but I know maybe later on in life, due to family history and other things, I may develop some serious things. So I want to go ahead and lock in my premium now and get it while it's low. And then if something were to happen to me, I'm going to have a high deductible where that comes out of my pocket. But then once that deductible is met, the coverage jumps in and covers pretty much everything else. Okay. So again, a lot of this is modeled after, your traditional health insurance plans that most of us are used to. Massachusetts, Minnesota, and Wisconsin are all, they have different standardized plans. So it is important to note that no matter what company or what state you're looking at any of these plans in, except for these three, Massachusetts, Minnesota, and Wisconsin, they're all standardized. And what that means, they're all the same. So Zach, let's say you're United Healthcare and I'm Humana. When we sit down together and we offer a plan, let's say G to our clients, the only difference in the plan is the company that's offering it and then potentially the premium, right? So your premium might be lower than mine, but we're both selling the same Honda Accord, if that makes sense. Okay. And then as far as eligibility goes, you must be enrolled in Part A and B to have a Medicare supplement. You do have to reside in the state in which you are applying for coverage. So that's important for, states where snowbirds come, Arizona, Florida, those different states. And then also 65 or older, or if you're under 65, that's available in certain states as well. As far as the costs, when it comes to Medicare supplements, it helps with some of the out-of-pocket costs that are not paid by original Medicare. Premiums do vary based on age, sex, tobacco status, so smoker or non-smoker, your zip code, and then the plan selected, and then obviously the carrier or the insurance company providing it. But otherwise, all of the benefits within the plan are the same. Enrollment is pretty easy. The best time to enroll typically is the 6-month, what we call OEP, open enrollment period, following your 65th birthday. So following that month, and then, or your Part B effective date, right? If that's later. Now, why that might be later, Zach, is let's just say, for example, you turned 65, but you're still working, right? And you like your employer sponsored plan, right? Part A is going to be automatic. So as soon as you become eligible for a Medicare and turn 65, you're just going to automatically have Part A. But you don't want to enroll in Part B because you have that great health insurance that you like through your employer. Now, let's say you're 70 years old and you're like, all right, I'm ready to retire. Now, when you retire, you're going to have that same open enrollment period for your Part B effective date. And that will obviously be that later time. And then that's when you can apply for your Medicare supplement. Does that make sense? All right. And then there's other situations where acceptance may be guaranteed. So that's going to be relative to health, where you worked and other things like that. Also, there's different opportunities, and we'll get into this in a later training because this is, again, your 101. But there's opportunities based on what your experience is with your Medicare Advantage plan where you might have the opportunity to have a guaranteed eligibility or enrollment in your Medicare supplement. Okay, so there's different plan choices. Here's a nice little visual to take a look at. All right, so step one, you have to enroll in original Medicare, right? So Part A, automatic. Part B, that's going to be, you're going to enroll in that. You've got a premium for your Part B, right, that you pay each month, typically out of your Social Security check. Now, step two for the client is to decide if they need additional coverage and then decide which way to get it. One of two ways. Option one, add one or both of the following to original Medicare, which is going to be a Medicare supplement, what we just went over, right, to cover the gaps that Medicare doesn't cover, and then Part D for prescriptions. That's option one. Option two is going to be Part C, Medicare Advantage, right? And Part C is going to combine Part A and B along with Part D drug coverage, okay? So when can your clients enroll, right? So the IEP, or initial eligibility period, is the month you turn 65, and then you have your 3 months before, and then your 3 months after, right? So I have, if it's, June, that's my birth month. I've got from March, April, and May, the 3 months before that, I have my birth month, and then I have my 3 months after. Make sense? All right. So what if I work, again, we just use this analogy with you, Zach. Let's say you work past age 65. You may enroll in Parts A and B. It's recommended that you do speak with your benefits administrator at, your employer. You do have to keep records of your health insurance coverage, and then enrollment after age 65. So when you're retiring, you may be eligible for what's called an SEP, Special Enrollment Period. And what that does, that allows you to enroll in original Medicare for up to 8 months after the loss of what's called credible coverage or employer coverage, whichever happens first, right? And then what's going to happen is you enroll in a Medicare Advantage plan or a prescription drug plan for up to 2 months after the loss of your employer benefits. So it's important to understand and know those windows. And obviously we'll have cheat sheets for everybody, but with most of the carriers and the Medicare platform that we're working with ElderCare, there's a lot of support there to make sure you're always doing the right thing. So if you're brand new to Medicare and you're working beyond 65 in a employer that has fewer than 20 employees, you have the same, open or eligibility period, right? So your 65th birthday with the 3 months before and after, right? You have your Medicare supplement open enrollment, right? Your eligibility begins the month you turn 65, right? So remember, back here, we were talking about Medicare Advantage and Part D prescriptions. And then here, we were talking about my eligibility working beyond 65 with fewer than 20 employees, right? So I'm coming off of a group health plan. And then my eligibility when it comes to a Medicare supplement, I have my eligibility beginning in my birth month, and then I've got my 6-month window, right? So the period lasts for 6 months and begins on the first day of the month, which you're both 65 or older and enrolled in Medicare Part B. Go ahead, Zach.
Is this just the guaranteed enrollment period? Because can't you always enroll though?
Yeah, correct.
Sorry.
Yeah, so think of it as, again, any experience you have with your group employer plans, this is kind of the same concept, right? So this is going to give you that guaranteed acceptance period, regardless of your health, regardless of anything, your Medicare supplement companies have to take you. If you're outside of this eligibility period, unless you have an SEP, special election period, relative to a specific disease or certain situation, you can then be declined, right? So you can apply for a Medicare supplement outside of this, and they can say, sorry, we took you through underwriting, we just can't accept you, right? So yeah, that's an important distinction. Now, one of the things we'll note in a later training is how to identify prospecting opportunities relative to people that are turning 65 and then different enrollment, scenarios. So additional elections, you have your AEP, right, which most people are familiar with. That's your annual enrollment period. That's October 15th through December 7th. And then that's for plans beginning the following year. So Zach, this coming October 15th through December 7th, when we're enrolling new customers, it's for their 2023 plans that will begin on January 1st. All right, you have open enrollment, and that's January 1st through March 31st. And that gives the client an opportunity to change from one Medicare Advantage plan to another, or back to original Medicare, either with or without Part D coverage, right? So maybe they made a mistake, they found out their doctor wasn't going to take that coverage, they moved, whatever, gives them the opportunity to be flexible and not locked in to that plan. They also have SEP, special enrollment periods. And those examples include moving into a new service area, right? Discontinuation of your current plan. So sometimes plans just, they just close, right? So they don't offer that plan anymore. And if that plan's not offered, then I can have a SEP. Also receiving skilled nursing care, and then also low income and Medicaid clients are SEP eligible. All right, so the next steps with our clients, what we want to do is review the enrollment periods. I think it's really important to become very fluent and familiar with your enrollment periods. So that way, when you sit down with a client, you can speak very fluently and you know the proper steps and plan eligibility and availability for that client. So definitely review that. The client does have to research their options. So that's one of the things we provide as brokers, asking questions and seeking help. And then we just enroll. And then each year, and this is what's great for us, is each year our clients can come back to us and re-enroll either in the same plan or a different plan. Okay. So Zach, at this point, any questions or anything else that we can fill in the blanks with as far as Medicare 101?
Yeah, so I had a question. So if someone has, like, let's say we sign them up for a Medicare Plan B, right? Mm-hmm. And they want to switch to Plan G 3 years later. What would they be guaranteed eligible since they already had Medicare supplement, or?
No, not necessarily. So okay. Yeah, so if other than having an SEP, right? So maybe they had a specific situation that allowed guaranteed insurability. 9 times out of 10, they're going to have to go through underwriting, so it's not guaranteed. It is different with the Medicare Advantage plans, though. So if it's during open enrollment and or AEP, the annual enrollment period, the Medicare Advantage plan will accept them.
Got it. Yep. And the biggest potential out-of-pocket cost or gap in coverage to me seems like that 20% out of pocket in some cases, right? How much is like just something that like an older person might deal with, like a heart attack? Do you know what the average price of a heart attack would be?
I mean, that could be $40,000 to $60,000 or more.
Okay.
Yeah, just in hospital costs, not to mention any of the doctor's services, rehab services stuff afterwards.
Okay. So that's kind of like the main, that's one of the important factors. That's awesome, dude. Mm-hmm. That's all the questions I have. So we'll wrap it up.
All right. Yeah. So that'll be for our Medicare 101. Stay tuned for additional training. What we'll do is we'll dive into specific frequently asked questions. We'll also talk about prospecting opportunities. We'll also have Robert Sterling on to do some specific training and really kind of help us get down, into the fine details of Medicare prospecting, servicing our clients, and making sure that we know all the do's and don'ts around Medicare as well. I appreciate the opportunity, Zach. Thank you.
Thanks.